Can I put questions out to students? I didn't.
Our learners, and they can unmute themselves too. So,
Okay. Oh, great. Okay.
hi everyone. Delighted to see you all. And we have another wonderful week adventure for the next hour together again. Um, Today, we're going to be talking, as you'll recall, about teamwork. And we have a wonderful team member of ours, Dr. Kirsten Johnson, who's going to be leading us through that. We have also the next few weeks, we're going to be, as you'll recall, talking more about community and about advocacy, and we'll circle back around to that at the end of today. Um, we will, Dr. Johnson's going to talk with us for a few minutes, and that will be partially interactive. And then we'll likely stay as a group of the whole for the whole hour, so that we can all have the opportunity to interact with Dr. Johnson for that whole time. All right. So, without further ado, Kirsten, would you like to go ahead and introduce yourself and launch us into the discussion about teamwork?
Sure. Thank you so much. Can everybody hear me? Is that I'm on? You can hear me, I
Yes.
assume. Great.
Yes, we
So
can.
I maybe I'll start before I introduce myself by sharing my screen. Is that okay? There we go. I think that's my screen. And I'll just see if I can put that into view, present. How's that? There we go. All right. How is that for everybody? Are we okay?
Super.
Miriam, nod your head
Okay.
if we're okay. Yeah? Thank you. So listen, it's a pleasure to be here with you today. And I'm presenting on teamwork and organizational performance. And interestingly, it's a timely presentation because I'm in Beirut, Lebanon. It's 11 o'clock at night here. And I'm working as part of a team for a humanitarian response. So I feel like I have a lot of personal anecdotes to bring to this particular presentation. And as you can see from this word salad here, that teamwork and effectiveness and organizational effectiveness really involves a lot of components from not only working as part of a team, but problem solving and conflict and negotiation and cooperation and so forth. And I'm sure that you've reviewed a lot of those terms in the robust readings that you had to do and that I actually went through today and read. And I thought, what a wonderful syllabus. So you guys are really privileged to have access to such an interesting course and great documents in reference to the content that you're learning online. So a little bit about me. That's me in the middle. I am an emergency physician, and I have been working in emergency medicine in Canada for the last 15 years, full time. I work in a quaternary care center. So that means that we are part of a super hospital, and we're the cardiac cancer transplant center at one of our sites, and then a trauma center at the other, and neurology and that kind of thing. So it's very busy. We have about 60 to 70 beds in that hospital where you see me in the middle, and very, very busy. Waiting room is always full. We're 200% over capacity. And so when you're talking about teams in healthcare, I definitely can check that box. We're part of a complex team of not only doctors and nurses, but allied health professionals and so forth, because we're taking care of cancer patients and cardiac and so on, as I mentioned. And then, of course, with COVID, that meant that we really did have to work as teams because we needed a lot of extra help at the front line. I'm also the president of the Canadian Association for Emergency Physicians.
Kirsten, we're not hearing you consistently. You might want to turn off your video for the moment.
Okay. How do
Thanks.
I do that? Let me just see. Stop video. Stop video.
Great. Yep.
How's that?
Yep.
Can you see? Yeah. Thank you.
Yep.
Yeah.
Okay. So I'm just going to go back. There we go. So the picture on the top right is from Nunavik. Nunavik is one of the Inuit regions of northern Canada and home to the Inuit people. There's 18 villages along the Hudson Bay and Ungava Bay coasts, and it's really the tundra. So I work up there as a doctor in one of the little villages that acts as a referral center for the other smaller villages that are home to nursing stations. And then I also do a lot of work in the humanitarian sector. I have an organization called Humanitarian U, and we provide online accredited training to humanitarian providers around the world. And those numbers are in the millions. So we work with partners all over the world to provide high quality training and professional development. And then on the other side of the screen, you'll see a couple of pictures from Beirut, Lebanon, where I am right now. And those are in reference to the Beirut blast and the fall of sort of the economy and the political situation here. And the people are very resilient and they have a lot of hope, and you'll see the Beirut, you'll rise again in that vein. So it's been an interesting time. I'm actually here. Sorry, I have to learn how to forward my slides. I'm actually here working as part of an emergency medical team under the umbrella of the World Health Organization, which is of course affiliated with PAHO, and PAHO is part of WHO. So I am the medical lead as part of this team, and we're here to help build capacity for the COVID-19 response in the public hospitals. So for the presentation today, some of the learning outcomes that I wanted to relay are that at the end of this presentation, you should, and at the end of course, reading the materials that you had to have prepared for today, describe the components of an effective team, list the types of conflict and strategies for managing conflict, discuss key concepts of group dynamics, and describe challenges faced by individuals who are working part of a humanitarian response team, and then also provide possible solutions to case studies on challenging teams. So what I thought I'd do is I kind of talk at you, but I really would encourage your participation. So if you want to unmute yourself and jump in and relay an instant, story or ask a question, please feel free, because I think it makes it that much richer. And then at the end of my short little section on slides, I've got 3 case studies, and I'll let Erica decide how she wants to do it. If you want to divide up into groups or we do them as a whole, but the idea is that it'll promote some discussion and application of some of these key concepts for you. So I'm going to start with a question, and I want you just to pause for a second and think about the last time you worked as part of a team. Maybe you're working as part of a team now, or maybe you had a recent experience, and think about if your team was effective, and if it was, why? What made your team work? And if it wasn't, why not? So while you're thinking of that, that's a photo of me and my team here in Beirut. Some of the people there have left, and we are the second wave that came in, and now the second wave is leaving, and the third wave is coming in to replace us this next week. So does anybody have anything they want to share about working as part of a team, and any interesting nuggets about what made the team effective or not? Well,
Hi, good afternoon, everyone. I'm Alicia.
Hello.
Hi. So
Hi.
I work as a team. I work as a team every day, I would say, because I work in the chronic disease clinic at my health facility. And we do try to be effective. I would say that some of the barriers to effectiveness would be a lack of communication among the team members. So, for example, if
Mhm.
we're not all on page with how we're going to proceed with management. So, in our clinic, you don't always see back the same patient that you initially saw. You may have to follow up a patient. So, if there's not lack of communication among the team members, then it leads to difficulties in making sure that we achieve the proper management for that patient.
Absolutely, absolutely. And so maybe you can hold that thought and think about, as we talk about some of the key concepts, how you might improve on that going forward. So it's a communication is definitely key. So on that note, maybe we should just review a couple of definitions. I think that would be helpful. Before we can get on to the discussion, we should just make sure everybody is on the same page in terms of what defines a team. And basically, it's just a set of two or more people who are interacting, and they're interacting basically together, adaptively, dynamically, interdependently towards a common and valued goal. And they usually have been signed or should have been signed specific roles or functions to perform. And the project has a limited lifespan of membership. So I guess you could say if you're married to somebody, you're a team, and hopefully that is going to last longer than a project at work. But that's the definition. And then an effective team is a one where the team members communicate with each other, as well as merging their observation expertise and decision-making responsibilities to optimize patient care or the project. And understanding the culture of the workplace and its impact on team dynamics and functioning will make a team member a good team player. So really this first part of this discussion is around effective teams and what makes teams effective. So certainly there's some principles if you look up effective teamwork or principles of teamwork, you're going to find that there's not just, these six, there's many other ways that you can look at this, but in a general sense, teamwork has a common purpose, and ideally there should be measurable goals. I think that that's a really important key piece, because if people are expected to work together towards a common purpose, they do need to feel that they're achieving something together. There needs to be benchmarks. If you're all working kind of without an overall sense of where you need to get to, it's very easy to have the team dynamic kind of fall apart. And so to avoid that, you really do need effective leadership. And as you all know, I mean, this isn't a lecture on leadership, but there's different styles of leadership. And that's a whole lecture in itself. There's transformative and laissez-faire and authoritative and all the rest. And I think that a good leader is all those things. And a good leader is also a good follower and knows when to let other people lead. So I think for a team to work together, the leader has to be very nimble, and sometimes has to be a manager and sometimes has to be a leader, but needs to keep the team focused on the end vision. That's ultimately the goal, and make sure that there are measurable goals that are agreed upon by the group, by the team, but that are in place so that the team knows that they're reaching their milestones. And of course, those can change as they go forward. Our esteemed colleague just a few minutes ago was talking about communication, and I think that's very important. And certainly cohesion and respect are part of that. So these are some of the values around, or the strengths around teamwork. The graphic there is trust and optimism and constructive interaction, communication, camaraderie, values, diversity, and respect. But those things don't just all materialize the minute you get put into a team. And I think that we forget that those kinds of strengths, and for those principles to come into play, it takes time. And you really need to be able to have that time and commitment overnight, especially if you have a multi-cultural and background team, people coming from perhaps, for example, in my team, which you can see a picture of here, we have I'm a doctor, and we have nurses there, we have an EMT, and so forth. So right there and then there's a certain team dynamic because of the hierarchy, but we're not also all from the same place of the world. There's some are from the UK, Scotland, Canada, and so forth. So, I mean, we bring our own biases, our own preferences, and so forth. So really, when you're talking about building trust and communication and everything else, it takes time, but it also takes a lot of work. So some strategies to building an effective team are, certainly there should be a mission. We're on a mission right now. As I said, I had a terms of reference given to me when I agreed to come here. And even though that terms has sort of changed over time, I know that I'm part of a mission. I know the overall purpose of the mission is to work on building capacity for COVID-19. And one thing that we didn't do, though, is develop team agreements. And this is in the literature that's been assigned to you, but I kind of like it because it kind of is like, when you're in kindergarten, and I have a 12-year-old son, but it's like the teacher makes all the children sit down and they write out the rules of engagement for the classroom, like, no putting gum in anybody's hair, everybody should be polite, these kinds of things. And of course, they'd be more sophisticated, but I kind of like that it brings people together and allows people to talk about what's okay for them, what's not okay, and to develop that kind of a working place, especially if you're a team that has not worked together before and you come together from different places. Certainly, I think it's very important to clarify team roles, and I can talk about this a little bit more in the conflict section, but it's very easy to step on people's toes. And so I think that this is something that certainly needs to be clarified, even if you think, oh, I know what I'm doing. I'm the doctor, I'm the nurse, I'm the technician. I think it's still worth kind of having that discussion as a team so everybody is on the same page. I think we can all take this point number 4 to heart, and that we should be always learning from our mistakes and failures, and that teams will fail and that teams will make mistakes. And I think that's a time for a team to come together and to grow and to reset their course. And then also to provide opportunities for the team to get to know one another personally. For Humanitarian U, it's a small social enterprise, but I had a small team working for me, and I would always take them out for a beer on Friday afternoons after work. And you don't have to take people out for a beer, but certainly you could take them out for a coffee or something else. But I think there's a lot of value in doing a team lunch or taking time with the team so that people can get to know each other personally and have opportunities that are outside of work to share, because that builds trust. So you can see in this picture here that we are all playing cards. We play a version of rummy that we call Lebanese rummy. And so it kind of is a time that we can break the ice and have a time that we're doing an activity that we can, all enjoy together and do kind of light chit chat. Anybody else have any strategies that they think are essential to building a team?
You've got a lovely question in the chat, Kirsten, as
Oh, I
well.
can't see it. Thank you, Erica.
Yeah, I can. It's from Felix. What does it take for a leader to create a common goal in a team despite diversity?
Well, that's a great question, Felix. And I mean, I'd almost put that back out to you. I think that there's always, if people are coming together to work on a mission or a common project, that even if they have a lot of diversity amongst themselves, that they can find some common ground. I think that a leader needs to build on that, to find a common point of unity that people feel there's like a value and commitment towards. and then build on that. And then I think, it's very important that if there's that much diversity in a group, that the leader then takes the time and invests that time to really make sure that people have an understanding of where the different members are coming from. They learn a little bit about them so that they can find touch points that bring them together as individuals and then also as part of the team. I think too, you have to be careful, that if people are feeling alienated because they're diverse and they end up, attaching to one other team member, that, you don't get clicks. So I think it's, as I said, a leader has to be nimble and has to sort of see these things happening and try and encourage teamwork and mitigate these kinds of potentials for disruptive behavior. And I when I lead teams, I try and be transformative. I try and bring out people's strengths and allow them to experience success early on by realizing their strengths. And if part of the group needs to sort of shift focus and let them lead for a bit or whatever it is, then I let that happen so that people feel more confident and the group has realized some success and we've got some early wins.
That's great. I might add as well, I think that this cohort has a particular advantage because we're in public health, and people in public health with high prevalence tend to have a sense of mission.
Right.
And so this is, while they may bring different backgrounds or prompts to it, there is an emphasis on the efficient beneficence of public health that I think we all tend to buy into, and that's something that all of us can start with as a foundation, I think.
That's a great point, Erica. Thank you. Yeah. Anybody else have something to add?
Hi, good afternoon. I'm thinking too, when we're thinking about team building, the emotional intelligence in terms of looking at leadership and understanding the dynamics of the people you are working with and what challenges they may be experiencing, and being empathetic as well as working towards the goals that the organization would want, but also being cognizant of the fact that a lot of changes are taking place and a lot of your colleagues may be experiencing issues that they may need a support from the workplace as well.
That's wonderful. That's very, very well said. Absolutely. It's it reflects on the skills that the leader needs to have, but also the sensitivities that other team members should have for each other. Thank you. So, let's see. So part of forming a team is, based on this group dynamics. And I saw this in your one of your references, but I've known about it before, and I think it does apply to groups and the stages of group. And I reflected on this today because this is exactly what I've gone through in the last 6 weeks. And it's so interesting because I surprised myself because, in the initial week, we did this forming period where we got to know each other, we exchanged some personal information, make kind of new friends, and we see how each other works. And then after a couple of weeks, there was some storming, and there was some conflict for sure. I was at the middle of a bit of it, but it's normal because I've got some big ideas, and I'm quite, I'm a big personality, and so it's about kind of finding our place. And I think, actually, to be honest with you, that some of the storming could have been avoided if the leadership was a little bit more in tune with the group. So that was an interesting reflection. But then, I also have had enough experience working in teams and in these kinds of settings, in public health settings as well, to know that I have to be responsible, and I need to address the issues and be tolerant. And so we've come to a place where we've done this norming now, and we've all kind of come to a mutual place of work, and we're performing. And soon, in the next week or two, we'll be adjourning and completing the task and breaking up the team and looking at what we've achieved. So I'm sure that as you reflected on teams that you've been part of earlier on in this presentation, if you thought of each of these steps, you could probably list the phases that your group went through. So what are some of the challenges to working in a team, and team effectiveness in particular? And this is not, what's the word? It's not limited to just these. But certainly I'm sure that you can think of some, and if you want to pitch in, you're welcome to. Changing roles and settings when you're asked to do different roles, and certainly working in public health and working in global public health, and even working in emergency medicine. I change roles from doctor to sometimes nurse to, sometimes I'm cleaning up things, or I'm teaching, or whatever it is that I have to do. I'm very malleable like that, but some people aren't, and they find that difficult to kind of be able to morph into different roles. Changing settings can be challenging as well. As we all get older, we like to have our things in the way we like them. So sometimes that's challenging to do. Hierarchies, for sure. And, of course, those of us who are also in the healthcare sectors, I'm sure are very familiar with the hierarchies that are entrenched in. I will tell you that this culture here in Lebanon really abides by the hierarchy, and the nurses will not do anything without the doctor telling them, even if patient care is in question. So it's very entrenched here. Different individuals, different personalities, instability, not knowing what's going on, if a project or a place or something like that is out of sync, failures and conflict. So, I mean, if anybody else wants to talk about some challenges that they can think of, but there are many, many challenges that can disrupt a team. And that's why, as I said, it's constant work. It's not something that you can just put into play and hope it'll bump along. There's always going to be some sort of challenges, but I mean, that's just also life. And so hopefully your team members will have some resilience and also commitment. And that's why it's so important to have the commitment to the vision and the goal, so that it keeps everybody on track. Does anybody have anything they'd like to say?
Hi, good afternoon.
Hi.
Yeah, I'm Dr. Mushtaq Ali. I'm a dermatologist, and
Hello.
my training is mostly on the clinical side. So this is an exciting experience for me to learn something about public health. So I
Yes.
just love this. It's just that I don't get enough time to keep my schedules and the deadlines. I hope I do finish at the end of this session. Anyway,
Sure.
what I have experienced is I'm here in Trinidad, and I'm in charge of the Hansen's Disease Control Unit, and I have a team working under me. And two of the main problems that I face is uh, racial differences and prejudices. That is the
Yes.
main thing I come across.
Thank
More
you.
so because I'm a foreigner. So I come from outside, and I have you know, uh, like a bird's eye view of what's happening, because I'm not involved in that. I'm not tainted with all those traits as yet, and I hope I don't do so as well. And the other thing is personality differences.
Yeah.
You have people who want to be
Yeah.
to show off themselves. There are
Yes.
people who have lack of self-confidence, and they feel threatened whenever something is said which might be perceived as a personal attack. It would be just a suggestion of improving the work or getting new skills or whatever. So these are the two things which I have come across.
Thank you. I think the first issue around um, equity and diversity and inclusiveness, you being a foreigner and feeling like there's some racial tension there, I think is a very good point. And thank you for bringing that up, because it's so easy for us when we're part of a homogenous group to not see that through, you know, the lens that you're seeing it. And I think it's a good reminder for everybody to step back and to think about certainly your position and the position of others who might be part of the team, who are different than the group, because we know that can create an intergroup kind of conflict if people are different and the group is seeing them as such. And I'm sorry that's happening for you. And then the other one with personalities, absolutely. I mean, it's very challenging to work as part of a group when somebody's got a personality where they feel like they need to be, recognized and attributed, and they create difficult, sabotage or create difficult situations. So I think those are two very, very relevant points.
Thank you.
Hi.
Hello.
Hi, this is Benjamin Puertas from the Pan American Health Organization. I'm in the general coordination of this course. But I'm very interested in what you just included in these challenges. And that reminds me a group I worked with in my previous assignment that is in Central America, where I was the advisor for the countries of that region in human resources for health. So we had the commission, and we met once a year or sometimes twice, but the rest of the time we work virtually. So we were really prepared to what happened now. And of course, you saw many of these challenges, like the commission was conformed by the HRH authorities from the different countries in Central America. So instability was very common because they changed according to, change of governments and so on. Of course, they were hierarchies. Some of them were the directors, other were focal points from the Ministry of Health. So that was also an issue. Changing roles and conflict, etc. But what you mentioned in a previous slide, I thought was very important, and that is how the persons interacted with each other. So we thought that those few times where we met personally once a year to review what we have achieved, they were really important, not only to create the technical expertise and reviews and everything, but to interact as people. So the group became really closed, and whoever came new, he was really welcomed and supported by the rest of the team. And we saw some collaborations started between the countries, just like in HRH planning, and the person from El Salvador would say, listen, I have some experience in this, I can help you, to the one who just started. So I think those are very important traits. And the other one is the simple rules. To establish simple rules with the group, that's very important. And they are simple, but not so simple, because that means that they have to be followed by everyone at all moments. And some of them are quite simple. I mean, respect, for example, one person talks at a time and so on. But those were really important. So that was something I wanted to mention. Thank you very much, Kristen.
Yeah, I think excellent sharing. That it's a great story, and thank you for sharing that. It's a good anecdote that brings into it provides a different context, but for the same points. So conflict. Well, oh, hello. Is that Felix?
Yeah. I would like to ask a question about group dynamics. Does it may I would like to know if sometimes it is not better to in order to have a better dynamic in a group, to dismantle this group and create another one, if we have some conflicts that we can solve. Thank you.
Sure. I mean, Felix, I think every situation is unique, and if there's enough capacity, if it makes sense to split the group into two groups and there's a common mission for each of the separate groups, if it fits the situation, I think that's fine. But often you have these problems and everybody has to stay together for whatever reason. Either it's to do with donor funding or the, geography or what the project is or anything like that. So I think that you can get creative and manage the group maybe in different ways, split it up so that people are working with other people where there's more team effectiveness. I think that there's got to be creative solutions to these kinds of problems. And so I don't know if you're thinking of something in particular, and maybe you can bring that up at the end when we're talking about potential solutions, and people can feed back. If you want to make that one of the case studies, you're welcome to.
What I wanted to talk about is, for example, we know when we for example, in health is something linked closely with politics. And in politics, we know there is always conflict of all kind between the parts of the politics sector. So my question is, for example, does dynamic in public health can be managed at the same? Group dynamics in public health, for example, can be managed at the same time, at the same way that we make politics or something like that. That's my question: is how to deal with politics in public health, with different parts, with how to manage the conflicts in politics when there is a link, when politics is linked with public health. That's my question, because I ask this question is because of my country in Haiti, where mostly we have some kind of interference between politics and public health.
Yeah.
And when you're a manager, in this case, you have to deal with that. It's very difficult to be productive when politics get involved in what you're doing in public health. So is there a way you can keep managing your group when you got political interference? That's why I would like to know more about. Thank you.
Yeah, no, I can appreciate that. And I think that public health is always, whether or not you're in Haiti or another country, there's always politics around public health. For example, you even look around mask wearing and the politics of that and so forth. So I know that from working in Haiti that there's definitely an intersection. And I think that, I don't know if you can avoid it. I don't know if breaking, groups into smaller groups, I think that it's just going to be part of what you have to do. And I think you have to find workarounds. And I think that's really probably, if that's one of your major challenges, then that has to be something that's communicated to the team and made sure that people either try and keep politics out of the team or that there's some rules around that. But I don't think you're alone. And if other people have other thoughts on how to manage that, they're welcome. But and I don't know if Erica, you have any thoughts on that you want to pitch in.
Yeah, and in fact, I think I was just sidebarring with Miriam a little on this. I think there's an article about CDC and COVID that I think is really useful to think about in this context. And I'm going to get that to you guys in the next couple days for us to maybe dive into in a little more depth, because it really, this has been a time for me of some pride in public health, but also of some shame as well, because it is difficult to speak truth to power in these kinds of contexts sometimes, but it is of the essence in our mission and leadership.
Mm-hmm. Thank you so much.
Yeah, I'll get you guys a little material on that for us to maybe dig into it some more. I think it's a really important question.
There's so many ways to structure if you approach it as a structural problem. There are ways to protect yourself and your team, even if you do have to speak truth to power. And I think if we tie back to the lecture on complexity, science, and systems thinking, when you think about how do you protect your team, how do you protect yourself, but how do you also make the movements in your system that may not be welcomed because of a political situation. There are ways to do it, but it's certainly not easy. You have to know the levers to press, and sometimes you need outside help. One time I was in a situation where I had to use those levers, and I consulted with outside organizations who were able to advise me well. That's all for now on that. Thanks.
Yeah, thank you, Miriam. And I think it's just, it's a tricky situation because you don't want to get yourself into some hot water, you know, but I think that both Erica and Miriam had some great points there. And hopefully you'll get something out of the CDC article that is distributed with for the group in the next couple of days. So, I mean, it's a nice segue into this next slide, which is on conflict. And I am not above, I have definitely let emotion into my dialogue with some colleagues, even recently. And so I really liked this quote that says, "Speak when you are angry and you will make the best speech you will ever regret." And so I don't know if many of you watch Netflix, but I'm watching The Crown, and the Queen is so, you know, she faces so many issues that would make me flare with anger so calmly. And so I'm trying to mirror her a little bit in my interactions with people, especially when I feel like my temper is going to flare, and just let my emotions cool down before I speak, because it definitely brings the abscess to a boil if you let your anger lash out in a team. So the great remedy for anger is delay. And we've already talked about some of these difficult types of conflict. One is the personalities. And I think as the more experience that I get in life, the more personality types I seem to see. And there's certainly a lot of difficult people out there that make working as part of a team trying at best. So I think part of that is also knowing yourself and knowing what sets you off, and when it's time for you to step back and just, you know, not speak out of turn, and how you can manage those kinds of personalities, because you're going to be confronted with them. Then we talked a little bit about intergroup conflict, and that's when a group bonds over something, but then they become almost convinced that they are in the right, and they see another group or an outsider in the wrong, and that can cause, you know, discrimination or otherwise, and that's a dangerous kind of a team to have. And then also cross-cultural, and so we see that globally, cross-cultural conflict and group conflict, different groups that identify in a way. So I think, you know, there's probably other types of conflict, but those are the main ones that I found. And oops, sorry. And so, you know, conflict, as I said, is inevitable, and both positive and negative consequences can occur. And this is where you really have to dig deep, and you need to know yourself, and you need to know what your triggers are so that you can keep yourself in check, but also that you need to be responsible for working through conflict and having those difficult conversations with colleagues, because results are likely better to be achieved with active engagement rather than avoidance. I mean, if you're working in a close team, this issue, whatever the conflict was, is going to continue to rear its head. So you need to, at some point, address it. And sometimes that might mean you need to have a mediator or a third person or a third party come in to help to create that kind of a neutral and safe space. But certainly there has to be at some point where that it's addressed. And so you need to have that motivation and commitment, because, you know, we talked about empathy a little bit earlier, somebody brought that up, but if you can put yourself in the other person's shoes and, you know, you're committed to the team, you need to have that care and be motivated to make this work out so that you can get on to the next phase of the dynamic teamwork, which is going to be norming and performing. And from that, you can learn, you can gain new skills around negotiation and cognition, behavior, and become more aware of your own self. And then again, that environment needs to feel neutral and safe. And it's tough, but everybody has conflict. It happens all the time. So the more you can open up, yourself and be vulnerable as well. And sometimes it just means that you have to take the first step and be the bigger person to address that. And this last bit, I just wanted to touch on partnerships because it has to do with working in public health. And so we talked about effective teams with individuals, but you can also have teams that are organizational, like what I'm in right now. So just to give you an example, we have, I'm part of UK Med, which is the human resources arm for UK EMT. And UK EMT is a consortium of 4 organizations. One is FCDO, which is the donor. UK Med is the human resources. Then there's a logistics and an operations organization, and they work together and they're implementers. So if you look at the partnerships, they're number 3. They're implementing partners to make the Emergency Medical Teams Initiative under the UK government effective, because to be a part of an EMT, you have to come with all of your own people, equipment, supplies, that kind of thing. That's part of the rule. So, and then we are here working under the umbrella of WHO. So WHO is kind of the number 1, the strategic or coordinating body. And we are also kind of in partnership with the Ministry of Health. So they're the facilitators. They're facilitating our entry into the health system here, and we're the implementers. Now, so you can see there's different kinds of partnerships, but I think it's worth a discussion because you really, as we talked about effective teams at an individual level, you can see how many layers there are to make those teams work. Well, it's the same for partnerships when you're working with other organizations in the public health arena. And you have to be very clear about what each partnership means and is defined as, and what the roles are, and really get people to agree to that, because nothing is worse than having a partnership where you end up doing all the heavy lifting and you're supposed to be getting support from this other partner and they're doing nothing, which can easily happen if it's not clearly defined. So I think there's, for me, principles of partnership, and as my organization, the Canadian Association of Emergency Physicians, we have a partnership with the Nursing Association to work on the Canadian triage system. And the nurses group went and did another partnership sort of behind our back with another organization for the same project. So we had to have an honest discussion with them, because they said that the principle of trust is sort of broken for me. An organizational partnership, if we're working together on a same project and our roles are defined, there needs to be some trust there. It's just the same as if you're working as individuals. So I think that, if you're working in a public health arena, again, with different partners, the rules are the same. And I think that, we can all think of examples like this, and maybe Miriam and Erica would have another example of organizational partnerships, and the kind of if it was a strategic or coordinating or facilitative, because I know that NextGenU has so many partnerships.
Certainly either of us could talk all day about those. I don't want to overemphasize NextGenU for this cohort anymore, though. And I am aware of the time too, that we only
Sure.
have a very few minutes left, and maybe you might want to try to hit one of the case studies.
I could very quickly just give another example. So
Sure.
If you just look at what's happening today, so Benjamin represents PAHO, and he would be the coordinating partner, and NextGenU invited Kirsten from Humanitarian U, so we would be the facilitating partner. And Kirsten from Humanitarian U is here speaking, and she's implementing along with the rest of us. So our roles are not quite as clear cut, perhaps, as they could be, but definitely are there. So that's just one example from today. Mhm.
Well, and just to, okay, and just to, this is a kind of the last slide before the case studies. I didn't touch much on organizational performance, and those are the other two competency areas that you're supposed to touch on in today's module. But just to say that for an organizational, for an organization to perform, it not only takes, team effectiveness, but it also is influenced by the external environment and by the capacity of the organization. And then the organizational motivation piece is really around the individuals working as a team. So it kind of is just like the next layer up. It's kind of easy to see. So I'm not going to go into too much detail here. Here's a picture of me in Haiti, actually, just after the earthquake. And just to put this into context, because the case studies have to do with humanitarian crisis, there's a lot of difficulties that individuals face to work in a humanitarian team as part of a disaster or an emergency response to a conflict or forced migration. So, I mean, I don't need to go through all of these. You can kind of imagine when I was in Haiti, we actually had to bring our own tents and our own food and everything like that. And often, we were tired and hungry and frustrated, and tempers flare. We're not as patient as we normally are, and that kind of thing. So it impacts a team. So there's 3 case studies, and maybe I'll just go through each of them, and you can choose one that we might just discuss. These are all real. So there's an emergency response unit team, and it's a joint national society deployment from 2 national societies. So Society A and B, and the team leader is from National Society A, and he's in his early 30s. National Society B has supplied 3 considerably older team members that have all worked together in the past. And as the team is working, the 3 members of National Society B are starting to form a closed group. They're excluding the team leader and outnumbering him. All the 3 members, they speak a different language than the team leader. So while they're working together, they're speaking their own language, which is not the common language that all of them have together. So the situation has gotten to a point that although the team leader and team members are all living together, the 3 team members now are not willing to share food. And the team leader is aware of the challenges affecting the rest of the team, but does not know how to fix the situation. Case 2 is your team is working in a hurricane response. It is challenging to locate the affected areas as there are reports of flooding in many areas throughout the country. There's no one affected area. In order to assess and coordinate, the team must travel around many parts of the country. Some of the team members don't agree with the strategy proposed by the leader to travel, and they want to stay in the capital and coordinate from there. So one of the delegates, who's the recovery delegate, he openly disagrees with the team leader. He says, I'm only going to stay in the capital. I'm not even going to do any assessments. And the reporting delegate and the other shelter delegate, they start a romance. And so some of the rest of the members are starting to form their own group, and they're not working well with the rest of the team. And now the team is splitting into 2 different groups. So some members are working well with the team leader, some want to work in the capital, and the romantic couple are drifting further away.
So Kirsten, given the time, why don't we dive into these first 2?
Sure.
If that's all right.
Yeah.
Great.
So these are some questions that you could consider about those 2 different, and they're kind of similar case studies. And I'll leave the 3rd one as part of the slides because I think you guys have access to the slides. So you can have a look at that after.
Thank you. That's great.
So Erica, maybe, I mean, you can, I don't know how you want to lead the discussion or if you want me to do it, but these are some of the questions that you might consider.
Yeah, given the minuteness of our time left, why don't you go ahead?
Sure. So, I mean, does anybody have some obvious considerations with these, like, can you list some of the challenges, the conflicts, what kind of conflict from the kinds that we talked about? And in particular, I'd be interested to know, does anybody have any solutions or strategies that they could employ to build a better team?
This is Philippe from the Bahamas. Thanks for the presentation. Can you hear me?
Yes.
Yeah, I think that from the 2 scenarios, I would say that the team leader did not exert their leadership in terms of the dynamics you asked us to think about, and the qualities of bringing the team together, common purpose, talking through what the agreements were, clarifying the team roles. And it's like, if you let the horse out the gate, it's hard to pull it back. But I think the team leader is going to need to really, with the first group, maybe speak to the smaller group individually and then bring them together, and address each group and then bring the whole group together. That would be my recommendation.
And what do you do about the romantic couple?
Again, I think sitting and talking with them, personally, some people don't like to be, in quote, embarrassed in the group, but if you pull them aside and speak with them, help them find out what's going on, help them to remember the mission, what decision they're going to make, what decision they need to make, because there should be rules and regulations. I think in the past, I would say just bring the whole group together and deal with it, but that's not good leadership, because sometimes that causes more conflict.
And so how would, and you or somebody else can answer, how would you motivate collaborative problem solving then? I think that's what you're saying. You would kind of do more collaborative, kind of get everybody together to agree on moving forward.
I would divide and conquer first.
Right.
So
Okay.
talk with each group and find out where they're at. But also we need a group decision. So bringing together unity, remember our mission, how we're going to work together.
Right. And I guess you could say, maybe if we could spend half the week traveling or and then the other half the week in the capital or something where you could find sort of a middle ground is one way too. Anybody else have some thoughts on the two cases?
Hi.
Hi.
I'd like to chime in. Are you hearing me? I think maybe finding the roles that suit the individuals might be a good fit as well. So some persons may be administrative. So you can give them the administrative roles in the capital if that is a possibility. And if others are more prone or better equipped to go out into the field, you can, I think, finding the skill set of the team might be one thing that we could approach, because sometimes we try to get everybody to do the same thing, and that's not necessarily the need of a team. So that would be my solution. Yeah,
I like that, because you make people feel valued for what they can bring to the table. You recognize that, bring out their strengths. That's good. Anybody have thoughts with the other group that were forming a smaller group and speaking language that wasn't familiar, excluding the leader from the first case study?
Well, sorry, if I can just chip in something else on the second one, Kirsten. There are important legal risk mitigation kinds of pieces that you got to do too, right? In terms of dealing with a newly romantic couple that could be, organizationally disastrous, right? If you don't do those kinds of things. So in terms of complying with mission, I just wanted to say that's something we all need to make sure we check.
Yeah, for sure. Yeah, yeah. And interestingly, somebody on my mission brought their partner here.
What I want to,
happens. Yes. Go ahead.
yeah, I would like to talk about the second scenario when we have a couple in a romantic relation. First, I would like to know if the rules were clear. So there was no in this group. If it exists a clear rule stating that it's prohibited for the team group to be in a romantic relationship.
Yes, for most humanitarian organizations, there is a clearly stated rule that you cannot have a romantic relationship. It's forbidden.
If it's the case, if it's the case, I think there is sufficient elements to state that they have violated some rule and they could be they could be thrown out from the group.
Yeah.
I think that's one solution that could be adapted.
How do you think that would affect the team?
So just to sit with them and explain them that for the good of the group, we should a decision has been taken so that they can be part of the group because there is a clear rule stating that this was prohibited and they've done it. and everybody knows that. So just to keep the group dynamic, and they should understand that they must step out in this case.
Right. No, it's definitely a thought for sure. Well,
Hi,
listen,
and
go ahead.
sorry, this is Roxanne from Bermuda.
Hi.
Hi. I think also that the leader has to take some responsibility, because if you take too long to deal with the situation, you are pretty much saying that it's okay. So establish the ground rules very early, and as soon as someone is not taking part in doing what the mission is about, they must be brought out. And I think sometimes as leaders, we wait too long and then we're in further trouble. And by that, the other team members are sort of saying, well, obviously it's okay, she's not said nothing about it. So I think if we nip things in the butt early and remind them what they're there for in terms of the mission and the vision, we can let other team members know that we mean business and this is what we are here to do. And I think all of us do that daily in our roles, and we change our different styles based on the situation. But I think the leader must be a bit more responsive early in the game.
Right. And that involves having a difficult conversation, but that's what makes a good leader is being able to have those kinds of conversations with people. So maybe we'll just take another.
All right. Oh, sorry. I think we're a little past the hour, and I've tried to be thoughtful about finishing on time, and also, please.
No problem.
Sorry, is there someone who wanted to?
Hi, this is Dr. Ali again.
Sure.
I just have two suggestions. One is that if I were to tackle any of these conflicts, I would like to take the subsets apart and talk to them as to how their behavior is affecting the common goals. And once that is passed across to them, then have a combined meeting where, as a leader, I would have had a vision, and I would project that and say what are the benefits that will be accrued through pursuing in those visions, and use that as a positive incentive for them to come on common ground and try to achieve those goals. Thanks.
Thank you.
Thank you. Great. So perhaps Dr. Johnson, if you have another few closing comments, and then I'll wrap us up for the week. Would that be all right?
Sure. I just wanted to say thank you so much. It's such a pleasure and a privilege to have this conversation with you this evening. And I hope that you can reflect a little bit more on your own qualities as a leader and a team member. And that, if I would encourage you to refer to the wonderful references that are part of your syllabus, because they're very rich. And thank you for giving me the opportunity.
Oh, thank you so much for being here. And if folks are particularly stimulated by some of these cases, and they want to post something further in the discussion forum, please feel free to. Would be delighted to continue the conversation there. I also wanted to thank you, Kirsten. I think that maybe we could plan for 2 weeks hence to have a beer or tea after our class. If anyone would be interested in hanging out, I think that would be kind of fun. Or beverage of your choice. And maybe we could even have that be part of our discussions. Miriam started in on the tea, it looks like. Very good. I'm working on fizzy water. So yeah, we can talk about the public health implications of our different beverage choices or other topics, right? So yeah, so let's perhaps think about that for after class 2 weeks hence, yeah? And with that, I will dissolve us. And again, thank you so much, Dr. Johnson, and the rest of our Next Gen U team. This was great example of form echoing function here. So thank you, and we'll see you all next week. Bye-bye for now.
Great.
Bye.
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 Bye.